If you're a nurse thinking about leaving the bedside, you should consider case management. But is case management actually a good career move? You don't want to make the wrong decision. You don't want to leave something familiar just to end up somewhere that is worse. Here's the reality. Case management isn't just a job change. It's a shift in how you experience nursing. At the bedside, everything is immediate. You're responding to what's happening right now. Patients need you. Tasks are stacking up. You're constantly moving, and the pace rarely slows down. You get used to it. You learn how to prioritize. You get faster. You adapt. But over time, something starts to shift. The physical strain builds. The long shifts start to feel heavier. And mentally, it can feel like no matter how efficient you become, you're always behind. And it's not always burnout in the way people describe it. Sometimes it's just a realization that you want something more sustainable, something where you can still use your knowledge, still help people, but not feel like you're constantly running. That's where case management starts to make sense, because instead of reacting all day, you're stepping back and looking at the bigger picture. You're asking questions like, what happens after this patient leaves? What could go wrong once they're home? What needs to be in place so this plan actually works? And this is where the role really begins to feel different. Let's walk through a real scenario. Imagine a patient who's being discharged after a hospital stay. On paper, everything looks fine. They're stable. Medications are ordered. Follow-up appointments are scheduled. Everything checks out. But then you start digging a little deeper. They live alone. They don't have reliable transportation. They're not fully understanding their medication instructions. Maybe they nod when you explain things, but you can tell it's not really clicking. Now suddenly, this safe discharge doesn't feel so safe because you've seen this before. You've seen patients leave and come right back. And this is where case management actually happens. You're not just checking boxes. You're stepping in and saying, if we don't fix this now, this patient is coming back. So you start coordinating. You arrange home health services. You make sure medications are actually accessible, not just prescribed. You confirm transportation for follow-ups. You slow things down just enough to make sure the plan works in real life, not just on paper. And just like that, you've changed the outcome. That's the impact of the role. Now let's look at another situation. A patient needs rehab placement before going home. Sounds straightforward, but then complications start showing up. There are no available beds. Insurance is delaying approval. The family is pushing for a specific location that doesn't have an open bed. Now everything slows down, and you're in the middle of it. You're making calls, following up, waiting on responses, trying to find a solution that actually works. And this is where the role can feel frustrating, because you're dealing with systems that don't always cooperate. But this is also where your experience matters, because you can see what the patient actually needs, not just what's written in the chart. You can advocate. You can adjust the plan. You can find alternatives. That's what makes a strong case manager. Now, does this role have stress? Yes, but it's different. At the bedside, stress is physical and immediate. You're running. You're multitasking. You're constantly reacting. In case management, stress is more mental. You're thinking, planning, anticipating. You're responsible for outcomes that don't always have simple answers. And sometimes that weight can sit with you. But here's where a lot of nurses feel the difference. You're not physically exhausted at the end of the day. You're not drained from being on your feet nonstop. Instead, you've been mentally engaged, focused, problem-solving, coordinating. And for many nurses, that's a better long-term fit because it's sustainable. It allows you to stay in healthcare, use your knowledge, and still have energy left outside of work. Now, this role isn't for everyone. If you love fast-paced, hands-on care, you might miss that. But if you like thinking through problems, if you like seeing the bigger picture, if you like preventing issues instead of reacting to them, then this role can be a really strong fit. So is case management a good career move? For the right nurse, yes. Not because it's easier, but because it's different in the ways that matter long term. You're still helping patients. You're still making decisions. You're still using your clinical judgment every day. But you're doing it in a way that's focused, structured, and sustainable. And for a lot of nurses, that's exactly what they've been looking for.